And okay, looks like no one else in the waiting room, so we can go ahead and start. All right, so today we're going to talk a little bit about some health, safety, and wellness topics abroad. A lot of this information is generally applicable to any abroad experience, but we'll talk as well a little bit about some specific things that you might need to know for these places. And we'll have space for questions if any of you guys have any topics that you're worried about, or things that you want to know more about. If we don't have the answer right away, we can definitely get you more information later on. So, all right. So just in general, we're going to talk today about health, safety, and wellness abroad. We will talk briefly about issues related to sexual assault or harassment. So just letting you guys know ahead of time, whatever self-care strategies you guys need, if you need to step away, or just want to talk one-on-one about this stuff. I know it can be a sensitive topic, so just letting you guys know ahead of time. But we'll get started. Okay, so I know last time we met, introduced this iceberg concept of culture. And all of these ideas of things that are above and below the surface also applies to conceptions of health, safety, cultural communications. All of this stuff is related. So I just kind of want to prime you guys to think about, what health and safety culture looks like here at Tulane, and how that might differ abroad. So some of the things that you might have as part of a health and safety culture here at Tulane. I know that peer health educators are really active on campus, and we have a lot of programs like the Stall Street Journal, the Goldman Center for Accessibility, the Americans with Disability Act. These kinds of things are in place in the US context to protect your health and safety, but they don't necessarily apply abroad. So it's just important to remember legal protections are going to vary place to place. And of course, we want you guys to be healthy and safe throughout this entire program. So if there are any issues that you're worried about, bringing them to us as early as you can, we can help work with, what does that look like in another context? So just things to think about as far as, how close physically people are, what communication looks like, what a disease looks like, but how people think about these things is going to differ a little bit place to place. I don't know, Borja or Felicia, if you have any examples or things you'd like to share with students about cultural concepts of health.
You mean in Morocco in particular?
Yeah.
Sure. I think common sense is like going to be my keyword. You guys have all been, several places in your lifetimes, different maybe parts of the US, maybe other countries. Common sense, right? Just think about how it might be for the people who are there to be looking at you, right? As well as you're looking at them. And I think anything can be fine with a little bit of politeness, a little bit of attention, a little bit of common sense. I guess that's kind of like my basic thing. And of course, for health, right? I think I told you this story, Morocco. When I went home 1 year from Morocco to the US, I was in the health food store and I realized every single thing in this health food store is what's eaten every day in Morocco. It's like a really, really wonderful, place, right? That doesn't mean there aren't things going on that are not good for you, but I'm going to ask for your common sense, your kind of good eye, you're kind of thinking it through, and I think everybody's going to do really well.
Spain is a very safe country in general. So you're going to be fine with that. And Seville, is a smaller place than Madrid or Barcelona. I think I told one of my students that last year when I was in Colorado College for a study abroad, one of my students fell asleep on the street and nothing happened to him, at 5 a.m. in the morning. So they didn't even take his phone, it's in Madrid. So and yeah, but it's nice to be polite. If people ask you how are you, ask back. Because that's very Hispanic. ¿Cómo estás? Bien. ¿Y tú? And Sophia and Alejandra know that because they're in my class. And yeah, But yeah, it'll be fine. But at night, walk together with another person if you're going back home. And but Spain in general is a very safe country.
So I mean, thank you guys for sharing that information. Just in general, like our faculty leaders are saying, common sense goes a really long way. A lot of the same practices that you would use here in New Orleans to stay safe will help you abroad as well. So sticking with other people, making sure someone else knows where you are, being careful with intoxication in public, that kind of thing. Just general good practices to use what in New Orleans or anywhere else, and especially a place where you know a little bit less about. Just being cautious. We don't want you guys to be scared all the time. There's no reason to be, but being alert and aware, because the problems with health and safety tend to happen when we let our guards down. So just make sure that you're alert and aware, sticking with other people, and you should be fine. All right. So thinking about health and safety in other cultures. So these tend to be, the bigger level things that we tend to worry about a lot when we're going to a new place. So these really high level, like what if I have a huge health emergency? What if there's a terrorist attack? What if something like really crazy happens? And then we tend to de-emphasize some of the baseline things. And to give you guys, to maybe shift your perspective a little bit. So this is a safety alert that's from the UK immigration page. What place do you think this is about? What country? Anybody can chime in if you'd like to. I'll give a couple seconds to read. Anybody wanna chime in? If not, that's okay. All right, so this is actually about the United States. So, things that people are worried about coming to the US are things like gun violence and terrorism. And this, you living here, you may not be as aware of. And knowing, places that having a familiarity with where you are, you tend to not worry so much about these big level things. And actually, just to give you guys a sense, the biggest things that students talk about as far as health and safety and the biggest issues that tend to come up are these kind of baseline health things. So stuff like dehydration, hunger, substance abuse, homesickness, these kinds of things are really the stuff, really the big health and safety concerns that we see on programs like this. So I just want to encourage you guys, take care of your baseline health, make sure you're drinking water, make sure that you're practicing healthy practices as far as substance use, and making sure that you're taking care of your own mental health. Thinking about culture shock and homesickness, these are really things that tend to impact students the most. So I don't want you guys to be super scared about these big, scary ideas that might happen. We are going to take care of you, and it's really taking care of your own health and well-being on a really basic level that's going to really ensure your success and your health and safety on a program like this. So just want to kind of try to calm you guys down and flip the script a little bit. It tends to be more basic things that happen as far as health and safety. So, and just some stuff about anxiety and stress. So we are going to be doing a lot on this program. We're going to kind of be going and going. You guys are going to be taking classes, seeing all this new stuff. And sometimes that can come with some anxiety and stress. And so just some baseline tips for you guys about if you are experiencing some of these things, you can come talk to me. We can go on a walk. I know I really like to do, leaving a space if I'm really stressed out, kind of finding ways to disrupt your own mental patterns. So reach out to me, we can go on a walk. Maybe it's academic stress and you want to talk to a professor about it. But it's just really important, check in with yourself when you are feeling these moments of anxiety and stress. Just some general tips here. So identify what you can and can't control. So discernment is important here. Sometimes there's things that are beyond us that we're just stressed about, but sometimes there's things that we can control. So being able to educate yourself, check in with yourself, you know yourself the best. So maybe there's a coping strategy that you like. I know personally, I like to leave my room, leave my house when I'm really feeling inundated with stress, going for walks, journaling, those kinds of things. But whatever your own coping skills are, you might want to think about that ahead of time and just make a plan If you are having a hard time, how are you, what are things you can do to take care of yourself? And just, it's really important doing a mental and physical health check-in. I know when I'm traveling, I tend to be really not as good at drinking water, taking my vitamins, doing things that I would normally do when I'm home. So just making sure that you're keeping tabs on your own mental and physical health. I know I am sometimes not as good at this when I'm traveling, so just make sure this stuff is important. We're there for a whole month, which is both short and long. So the feelings that you're feeling are valid, and we want to address them. So try not to hold on to things that are happening, whether it's physical or mental. Please let us know, because we might be able to help you. So just want to let you guys know we're here if you need anything or having any issues. All right. And so we talked a little bit about culture shock. But in general, on a short-term 1-month program like this, we tend to see the most struggle around weeks 2 and 3. So just keep in mind, culture shock may present itself a little differently based on who you are, how you react to things. But some things you might notice in yourself, it's just important to check in. But especially around the halfway mark of the program, you might start to feel some of these things. Some things are long-term issues, so you may struggle with with a mental health concern, but some things are situational. So if you're feeling irritable about things, or you're sleeping more or less, you're feeling homesick, whatever those things may be, just keep track of how you're feeling. And some of those may be attributed to culture shock, and there's some ways that you can mitigate this. The biggest thing, though, remember, we're all going through this program together, and there's probably going to be some moments of tension. That's totally fine, and some moments of culture shock, but we're here to walk you through it, and we're all in this together, so it's nothing to feel weird, guilty, ashamed about, any of that. So it'll be a really great experience, and as we generally see, that week 2 to 3 mark, people start to, feel some of those moments of crisis, but toward the end, we also see that students feel better and are adjusting and don't want to leave. So try to remember nothing is permanent. A lot of these feelings are temporary, and we're here to work through them with you and to make it better. So you're not alone in any of it. So another thing just to mention to you guys, so COVID-19, a lot of the restrictions related to this have been lifted, but I just generally encourage you guys, monitor your health before you go. So neither Spain nor Morocco currently require a PCR test, unless you guys know differently. So this isn't a requirement, but you might want to consider getting tested ahead of time. There's also facilities in country that you can go to for testing if you're worried about it. Just monitor your health in general. This is subject to change, but as far as we're anticipating, we don't see too much of an issue with kind of COVID restrictions as far as mobility. I would say, though, just in case, you probably want to have some kind of copy of your vaccinations, just in case people ask for it. I really don't think they will, but doesn't hurt to keep with you. A photo is probably sufficient. And I also recommend in your packing list, you might want to bring a thermometer, hand sanitizer, masks if you need them, and then maybe a rapid test or two, just in case you need any of that. But like I said, generally, most of those restrictions for the pandemic are lifting. So I don't know if you guys have any input on that, but. And just some quick facts here. So both in Spain and Morocco, a lot of folks are vaccinated around similar or higher levels to the US. So in Spain, we have 85%, Morocco about 62-63% vaccination.
87.
87 now. Okay. 87. All right. Good job, Spain. And it also is going to depend on where we're going. So more rural places, just like in the US, are going to tend to have lower vaccination rates, and then the cities are going to have higher vaccination rates. But in general, a lot of people are vaccinated, just like in the US. Yeah, Borja, what you got?
I just see in Spain, masks are still required in healthcare facilities, in all healthcare facilities. Okay, so including pharmacies. That nobody respects, but just for you to know that including pharmacies, if you need to go to the therapist, physical therapy, hospitals, they're required. Yeah, and Spain was the last country in Europe to lift the mask mandate on transportation.
Gotcha. So that's no longer required for transportation?
No, like two weeks ago.
Gotcha. Wow. Yeah.
Yeah.
So in some cases, yeah, in some settings, you may need a mask. So I recommend bringing some. You'll probably be able to buy them abroad too. But just in case, bring a couple in case we need them for certain settings, especially healthcare, and that kind of stuff. And when in doubt, follow the locals is my recommendation. So there might be certain settings where people are more cautious about COVID over others. But in general, if you have symptoms, make sure to self-isolate and notify us immediately. Same thing if you have other illnesses, we want you to be taking care of yourself, not getting other people sick, that kind of thing. So common sense here, but let us know if anything's going on as far as your health. We want to make sure that your health is being addressed. And in general, most planes don't require you to wear a mask. However, I know that pre-COVID, anytime I would fly, I would always get sick. Wearing a mask is a really great way to not have that happen. You don't want to be sick on this program. It's so short. You don't want to miss any of the really cool things we have going on. So I know I will be wearing a mask. I recommend you guys, when you're flying, maybe even on public transit, that kind of stuff, consider it. It's really the best way to protect your health from COVID and from other things too. So when you're going to be in the air with a bunch of people for like 20 hours, I don't know how long the flights are, you might want to wear a mask. That's just my 2 cents, but it's not required. All right, and then independent travel. Our baseline, I don't recommend leaving the country. So if it requires getting on a plane, probably not a good idea to do during the program. So we do have some overnight weekend excursions scheduled. So we are going to go to Granada and Cadiz. So you're going to get to see these places. But the big thing, you're going to have free time, and I encourage you to explore, take advantage of this free time, but just don't go so far that one of us can't get to you in an emergency. We don't want you, going off in the middle of nowhere without anybody knowing where you are, that kind of stuff. The other thing, part of studying abroad is really getting to know the place that you're in. It's being really immersed in it. And so I always recommend slow travel by foot, walk around, get to know the neighborhood that you're in Seville, or in Morocco as well. But what you do before and after the program is your business. So if you have things that you really, really want to do, that's maybe in a different city, I encourage you to take advantage of that travel after the program. Any input on that from faculty?
There really isn't any time, guys. I mean, between your classes and the excursions, we want you there. We want you there with us, and we're going to make it really, really fun. So, I think that's great advice, Emma, that if there's really something you want to do somewhere else, for example, in Europe or somewhere else in Morocco, after the program ends is a good time, or before it starts. Great.
I'll be in Madrid after the program, visiting my grandmother. So if you want me to tour you around Madrid, I'm here. Okay.
Oh, what a nice offer, Borja.
It's just that, Madrid is my second home. My granny's been living there since 1939. So
wow.
Well, I'm so glad you get to visit. That's great. All right, so moving on. So you guys are adults, and I want to honor that. So talking about romance abroad, you guys are going to be really busy, so there's probably not going to be a lot of time to do this kind of stuff, but just thinking about what romantic norms are, especially if you're planning on enjoying the nightlife and the revelry of these places. So think about romantic norms, how they might differ, and I'll definitely if you have more questions about this, we can talk about it more in depth, but just keep in mind, especially in Europe, Spaniards tend to be a little bit more forward. Expressing feelings is quite common, but public displays of affection are going to vary based on where you are. So it's a bit more common in Spain, tends to be a little bit more taboo in Morocco, but just keep in mind that your boundaries are your boundaries regardless of where you are, and you don't have to bend them because of host culture norms. So, please make sure that, check in with yourself if you're going to be interacting with people, and know that you don't have to do something just because that's the culture. Especially though, people tend to dress to impress in both Spain and Morocco. Athleisure is not really a thing. So especially if you're going to go out, something like that, I recommend bringing some nicer clothes. for that kind of thing. Also thinking about that there might be differing attitudes and technical legality of LGBT identities in Spain and Morocco, but in general, both of these places are pretty welcoming, especially in the cities. So I don't know if you guys have any context on that, but just make sure, check in, what are you comfortable with? And also think about what is the availability of safer sex supplies. It's going to vary based on where we are. So if you do think you're going to need that stuff, you might want to bring it with you. All right. Keep going. So talking about emergency response. So on Tulane's end, we'll enroll you in something called Crisis 24, where you're going to get kind of automatic updates about emergencies that are going on, political unrest, etc. Just as a general rule, you don't want to get mixed up in things that are happening as far as protests go, that kind of stuff while you're abroad. In general, if anything is going on, we want you to contact us if you feel unsafe, that kind of thing. And generally, make sure you're keeping with other students. While you're going out and exploring, we don't want you guys going anywhere alone. Yeah, I don't know if you guys have any more input about what that looks like, emergency response abroad, but in general, we have a chain of command. So as far as if you want to tell us anything, just know that myself, as well as your faculty members, are mandatory reporters. So if you do come to us with any, information about being the victim of a crime, anything that is kind of a concern, we do have to report that up through the university. So I just want to let you guys know. As far as reporting to Tulane, you don't necessarily have to do anything with that information, but we do want to make sure you have access to Tulane's resources since you are a student, should anything happen as far as emergencies go. So I just want to let you guys know, we are mandatory reporters, but we do want to know if something's going on. So please come to us if you have any worries, any concerns, or experience any crime, theft, harassment, etc. We want to know so that we can help. And we're not going to be sharing that information out with a lot of people. It's really on a need-to-know basis, and it is confident. It is private, but not confidential. So we will be sharing that kind of with the university crisis response team. So, all right. So here we're going to talk a little bit about sexual assault. This is kind of a really general discussion. A lot of these things you've probably had to talk about here at Tulane's campus too, but just going to give you guys the warning that we are going to talk a little bit about this. If you need to step away, that's also totally fine. But in general, I encourage you guys to research the norms of the host culture. There have been a lot of articles in the news in New Orleans, in the US, as well as abroad about what sexual assault means. I think as a global entity, we are all becoming more aware of some of these things that are going on, especially with Me Too movement, that kind of stuff that's happening culturally. I think it's really good that we're talking about it. But just keep in mind, the way the law works in different places may protect you in different ways. So I just want to give you guys some context here, thinking about it from local context. So New Orleans, people tend to say might be an unsafe city, but your familiarity with the community around Tulane generally means that you probably, I hope, feel pretty safe in your day-to-day routines and are able to navigate the city, know locations that have higher prevalence of violence or criminal activity. So beyond that, thinking about how you travel around the city, if you're planning to go out with friends, where are you going to go? You would probably tell someone where you're going, and you're probably not going to go places alone at night. So just some of those same things that you might think about in New Orleans definitely apply abroad too. So just general risk mitigation. In general, be cautious. Some behaviors can make you a target no matter where you are. Things like public intoxication might, raise the risk of being the victim of a crime. Not that it makes it okay or your fault, but just things like that. In general, observing locals really, really helps. So how do other folks behave in public at night? When are they going out? It might be worthwhile to talk to some locals before you plan on going out to get a sense for where you can go. And in general, like I said, we don't want you guys to be scared, but we want you to be alert and aware. So try not to let your guard down. That's when things like theft happen. So make sure that you are alert, aware of yourself, your own physical space, and as well as your belongings, just to make sure that you're aware, that kind of stuff. And as far as if something happens, whether you're a victim of a crime, or just something feels off to you, some things you can do kind of on a triage level is called local emergency numbers. If you need to file an official report, if you need medical care, seeking that, but especially in those cases, please check in with us. So with myself, your professors, or the program at large. So when we're in Spain, we're going to be working with CIEE. And when we're in Morocco, we're going to be working with Lechi Tours. You can contact me and we'll kind of notify other folks, but there are other resources you might want to lean on. So your parents and family, please let us know though if you are, if something is happening. That way, if your parents call us and say, what's going on, we want to know too. As well as with Tulane. So you still have access to campus resources, so case management and victim support services, as well as counseling. So whether that is making an appointment with your Tulane counselor or figuring out local resources. Should something happen, we want you to be supported. And I just want you to know that you have resources should anything happen. And we hope it doesn't. And we'll do our best to keep you guys safe. I'm quite confident that you guys will be safe on this program. But just like in New Orleans, things can happen and we want to make sure that you have resources and options. Another topic that we bring up when students go abroad is something street harassment. So this is something that you've probably experienced to some degree or heard of in the United States as well. And you might also experience this abroad, though experiences may vary between Spanish and Moroccan context. But in general, it is not your fault if you are harassed in public, but there might be some ways to mitigate these experiences. So these are some tips that are general. I encourage you to use them in New Orleans as well. Because this can happen really anywhere in the world. Unfortunately, we are in a patriarchal world, and these things tend to happen, especially to women and other gender minorities. So big thing, a good point of advice, if you're able to ignore it, try not to make extended eye contact and engage with it. It might make it worse. Don't go off by yourself in unfamiliar places. So buddy system is really, really important, especially if you don't know the neighborhood. So buddy system, super, super important. Yeah, just in general. However, if someone is persistent, you might practice saying no in local languages. So in Spanish, it's pretty easy. I believe in Darija, it's la, just like in modern standard Arabic. Okay, yeah. So practicing no, if people are really persistent, that's something you can do.
Can I just add, Emma, can I just add that no, a very strong no is universally, understood, right? You say no, you say it loud, you move on, you keep walking.
Yep, exactly. I'm gonna just a general rule of advice, be cautious talking to strangers. Sometimes friendliness can be construed as interest. I know this is true in the US as well. So just be cautious. If you don't know the person and you don't know the environment that you're in, you might want to avoid it, especially with opposite gender folks. And lastly, I keep saying this, almost always it's best to mimic locals, and when in doubt, dress modestly if you're not sure about the situation you're going to be in. So make sure to bring options for clothing, that kind of thing, for when we're traveling. But yeah, just general advice there. For street harassment, same thing you would do here pretty much. But yeah, just want to let you guys know and let you guys know that you can talk to us about these things. If something happens, we want to know and we want to help you through it. So all right. So another topic that might come up, so substances. So most of you, probably all of you, are able to drink in these places. So in Spain, the drinking age is 18, I believe, and in Morocco, it's 16 if you're not Muslim. But generally, drinking in Morocco is a little bit more taboo. So just keep that in mind. The big thing, you're not excused from class if you are hungover. Try not to overdo it. You want to protect your own health and well-being. When you are abroad, we want you guys to enjoy, the revelry that is on offer in these places, and participate in local customs. So like cocktails with tapas, that kind of thing is really normal in Spain. But behave as the locals do. Try not to get bourbon trashed, kind of thing. Cool. Other things you might want to think about. So drugs. In the US, we distinguish between things like CBD and THC. In Spain and Morocco, as far as I know, they do not. Marijuana is illegal in these places. It might be decriminalized, but in general, it's not worth it to test the limits of legal gray areas. This is also something to think about with harm reduction. So making, using alcohol and drugs tends to increase the number, tends to make you more likely to be the victim of a crime, whether it is pickpocketing, etc. So I would just say, be careful in public spaces, reveling, that kind of thing. And just know that the laws are a little bit different. And I would say, try not to push it. The big thing though, identify your own personal habits. What are your coping skills? And I encourage you guys, come talk to us if you're having a hard time. We don't want you guys to, use other substances as a crutch, that kind of thing. We want you guys to be healthy and safe the whole time you're abroad. So this is part of it too. Lastly, I know smoking and vaping is super cool with the kiddos these days, but it's definitely not allowed on a plane or in an airport. Please don't do it. You don't want the FAA confiscating anything. You're not allowed to smoke or vape on a plane. So make sure you're planning accordingly. Anybody, faculty, do you have any input on these things at all?
Borja, you want to say a word about Spain?
The time you're drinking, don't, you can go out. Seville is like New Orleans, you're outside, you're going to be having beers if you want, or even calimocho or sangria, whatever. But you can pace it, you don't have to, because I went to school in Massachusetts and those kids drank so quickly, because everything closed at 1, so but it's cool. And so I think Sophia is taking my 2 classes, right, in Seville. So I'm going to be teaching at 10:30 and noon. It's going to be a little later, not at 9 a.m. in the morning. So you can sleep in a little, and that's fine, because Seville, as we all know, it's very hot from 2 to 7. So you're gonna go out 7, which is going to be nicer, and then all the terrazas in bars have the sprinkling water, and you can go, and you'll be fine, and people in Seville, they talk a lot. So you're going to be there, and even if they don't know you, they're going to start talking to you. Okay, so just that.
It's also okay not to drink. I want to emphasize that as well. If it's something you're not comfortable with, or something you don't have a lot of experience with, you might want to abstain, and I totally support that. I know a lot of folks, young sober people, it's a lot more normalized, especially in New Orleans. I think there's kind of all or nothing mentality, but moderation really helpful. Spacing drinks, drinking water, all that kind of thing. But kind of the same safety tips you would use here in New Orleans. I encourage you, don't go crazy while you're abroad. You want to make sure that you're actually able to make it through the program. So just letting you guys know, and I'm here to talk about it if you have any worries or feel nervous about any of this stuff. Okay, well, we can keep moving on. Talking about, I know Tulane does have a party culture. So this is from 2013, I'm Schmacked. I don't know if you guys this might be a little outdated for your own, but like Barstool kind of thing. We want you to have a culturally enriching experience abroad. So I encourage you guys to think about, what are the drinking norms and cultural rules at Tulane? What are about these things are American? And maybe what are some of these problems that arise when we bring American drinking culture elsewhere? So like Borja was saying, in Michigan, if they, or Massachusetts, I don't know which one you said. Massachusetts. Yeah. So, some of these things about people, the way people celebrate, the way people drink might be a little bit different than in Spain and Morocco. And so, how can you adapt these rules to fit a new context? And I just want to remind you guys, student conduct rules do still apply. There are no excused absences for being hungover. If we get noise complaints or anything like that about you guys while you're abroad, Tulane conduct process still applies. So just be respectful with everything you're doing and make sure that you are being responsible. I encourage you guys to enjoy, the local party culture, the local ways to enjoy things. There's some really beautiful ways that people go out and have fun. And I want you guys to have a lot of fun on this program, but just be mindful and be respectful of those around you, kind of common sense stuff. A lot of the stuff can be boiled down to common sense. So stuff to think about here. Okay, so health insurance, like I said, you guys will be enrolled in iNext coverage. I just want to make sure you guys are aware, you've probably been getting emails from CIEE about completing, uploading some documents in their portal. So make sure you're doing this. This is how you're going to get enrolled in this insurance coverage. And I think the deadline is the 28th, I want to say, of April. But if you can do it sooner, I recommend it just so that you don't have to worry about it later on and we're not following up with you guys. Just make sure you're completing all those documents on the CIEE side. And in general, so insurance covers basic medical stuff. It's probably not going to cover things like, glasses, dental care, other property liability things. So just make sure that, maybe bring an extra pair of glasses, some backup contacts, whatever those things are, just in case something happens. And especially, I just want to let you guys know that insurance does not cover you guys operating any kind of electric transit or doing really dangerous activities. So things like bungee jumping, jet skiing, etc. If you have to ask if it's okay or safe, it probably isn't. So just use some common sense here as far as the activities you're doing. If you want to do that stuff, do it after the program, please. All right. Cool. And we've talked about this a little bit as well. I just want to remind you guys, if you have any medications, make sure to bring the medication in its original container, the prescription. Just to be safe, I always recommend bringing a statement from your doctor that explains your condition, why you have the medicine, as well as keeping a receipt from your pharmacy. All of these things will help as you're bringing medications into the country. If you're worried about any of this stuff, please email me and I can put you in contact with our partners abroad. I don't need all the details of your health. Of course, that is your business, but I can put you in contact with our partners just to make sure if there's any concerns about bringing medications that you're able to address them ahead of time. So the earlier we know, the more we can figure out with you guys. All right, so I'm going to do a time check here and we'll come back to the case studies if we have time. I just want to say some apps that you guys might want to download on your phone, either now or closer to the program. Duolingo is great for practicing language, but especially for Darija, there's some really great YouTube channels for local Moroccans teaching you how to pronounce things, just some basic phrases. I mentioned Tulane will enroll you in Crisis 24. This is our emergency service, so you're going to get updates about emergency situations, any kind of goings on that might be health related or safety related in a certain country, wherever you are. And it's also how you're able to call local crisis numbers. If you don't know them, you can always access them in your app, Crisis 24. So some point before the program, make sure you're downloading this app. Otherwise, I'll bother you on program about it. Some other ones to consider as well. So Google Lens, that's this guy right here, the multicolored, is a pretty cool app. They do, you can take a photo of anything in another language and it'll auto-translate it. It's never 100% accurate, but usually it'll give you a sense for what you're looking at. So I find it helpful when I'm traveling, as well as WhatsApp. So I'll be making a WhatsApp group for you guys before we leave for the program. So make sure you're filling out that survey I sent out earlier today, just so that I have your phone numbers and can put you guys in a WhatsApp group together. That's probably how we're gonna be sharing the most of our kind of program announcements, that kind of thing. But just to reiterate, you do need to have some kind of cell service just in case you don't have Wi-Fi. So start thinking about what that's going to look like for you. And if you have questions specifically, we can talk offline as well. But yeah, so WhatsApp group is going to be kind of our big group chat. It'll work if you have an iPhone or an Android, so that part doesn't matter. And it's good for having us kind of all in a group together. I will, closer to the program, I will be sharing my personal phone number with you guys. That is only for use on the program. When we are done with the program, you do not have my number anymore. Just want to let you guys know. But in general, leading up to the program and after the program, you can email me. That's probably going to be the best way to get in contact. But on the program, I'm available 24/7. So if anything is happening, you'll have my cell number. But I just want to set that boundary ahead of time so no one's confused. But yeah, so these are some apps that you might want to look into, more to come on that as well. Some general to-dos for you guys. So if you haven't booked your flights already, I encourage you to do so as soon as you can. They're going to get more expensive as we lead into the summer. So make sure you're booking through Concur so that you have that support. If something happens on your flight and you didn't book through Tulane, there's not a whole lot I can do to help. But if you book through Concur, we do have 24/7 support and travel agents. So if you miss a leg of your flight, something happens, they can rebook you quite easily. Also, make sure you're completing your CIEE registration. So that's on the my.ciee.org. And you'll be getting emails about those as well. If you're having trouble finding it, reach out to me, I can connect you. And then some general things. So if you don't have an international plan or aren't going to get one, you might be able to have your phone company unlock your phone so you can get a local SIM card. Also notify your bank that you were traveling, though I think this is becoming less important as chips are more of a thing. But can't hurt to let them know what your travel dates are, just so that they don't kind of flag your account and that you have access to your funds. Same thing as last time. If you have accommodations or any medication concerns, please let me know. Lastly, if you might be eligible for a COVID booster, I encourage you to talk to your doctor or pharmacist. I know I get mine at Walgreens, so it is as easy as going to your neighborhood pharmacy to do something like that. And lastly, I have this survey right here that I will put in the chat at the end of this. If you haven't already filled it out, please do sometime soon so that I can make our WhatsApp group kind of get things going, and also confirm your course registration just in case there's any confusion. All right, so all right, a couple other things. So as far as roommates go, I just want to let you guys know up front, sorry to the ladies, we will probably have one triple occupancy room during our hotel stays. So if there is a group of 3 of you who know each other and feel comfy being in that triple room, let me know. Otherwise, it will probably be randomly assigned. So just let me know if anyone's interested. You can email me if you think of it. Also, next Friday, we're going to have our in-person social. So that might be a good time to get to know each other and figure that out if you have preferences. I know when I was a freshman at Tulane, I had a triple room and it was really fun, actually. I quite enjoyed my triple. We were super close, maybe too close, but it was a great experience for me. So just throwing that out there. I've been through it too. And it won't be for the whole program either. It'll just be for our kind of hotel days. All right, great. So I'll leave it. If anyone has questions, we can open up the floor. If you guys have anything you want to talk about as far as health and safety or just program stuff in general. How are we feeling? Can we get a check on temperature?
Does Concord have like a website? How does that whole thing exactly work?
What was that?
How does like the whole travel agency thing work? They've got like a website or something?
Yeah, I can share the travel page with you. So you can access it by logging in through Gibson. It's called Concur, or you can type in concur.tulane.edu. But this here has full instructions about how to use it. So you can either book online through the website Concur, or if you'd like to use a travel agent, they can help too. Especially if you think you might have a complicated itinerary, might be worth it to pay the extra $19, I think it is, for the travel agent service. So up to you how you want to do it. I just booked on the website, but either way is fine, but that'll have information for you guys. And the other thing, I do want to give you guys the link to the survey. I emailed it out, but in case you didn't get it, this is our survey to get phone numbers for the WhatsApp, kind of do a temperature check with you guys and verify your course enrollments. So when you get a chance, fill that out. If you don't, I'm going to start bothering you. So just heads up. Right. Any other questions right now? But I think I'll be able to let you guys go a little bit early if not.
I do have a question. Who's taking the film class with me?
Raise the hands.
All of you. So I'm going to be asking individually. Haley, as a 4,000 or 3280?
3280.
3280. Sophia is as a 4,000. Megan, 4,000 or 3280?
I originally planned for 4,000, but I changed my Spanish major to a minor. So is it like, do I not have to do as much if it's a 3,000?
Okay, because Caroline,
I can't remember.
you need to check it, okay? Because I need to talk to the undergraduate program director in Spanish. Kayla, what are you doing in the end?
I'm gonna do it as a 4,000 level.
4,000, okay, and Glenn as a 3280. Yeah, I know that. So if you want to take, like Haley and Megan, if you want to take it as a 4,000, I'm teaching 3280 in the fall, okay, on campus, because the class is going to be in English, and Dale doesn't want a 3,000 to be taught in English. Okay, so you can take it. We can give you an exemption of, like, you can jump that level and then come back and take 3280 with me or with John Charles, who's teaching it, or 3270 with Kathleen Davis. Okay, it is the same requirement. The only thing with Kathleen Davis is the class is online. That's the only thing. Okay, but if you want to take 3280 with me in the fall, I think I still have some room. And yeah, because I need to talk to Dale about that. And then you're all Spanish majors and minors, right? You know, yeah, I know, yeah. So, and remember, Megan, I think that the difference in between a major and a minor is just 4 classes. So you can still keep your major.
Right. I just was saying, I only need one 4,000 now. So like.
And then you can keep it, and then you'll see in the future, right?
Okay.
You know, because I mean, for example, Sophia is just so close to finishing her major in Spanish, you know. So just letting you know, okay? And because I'm meeting with Dale Sugar about this, because if everyone, so in theory, Tatiana, who was the person who was gonna teach this class, had scheduled this class to be taught in English, okay? When I saw that all the people were majors and minors, I said, great, I'm gonna teach in Spanish. But then I don't know, so everyone is comfortable with me teaching the class in Spanish? Yeah?
I think we might have 1 or 2 students who aren't here who would need it taught in English.
I will verify with Dale. But for you girls who are here and are major, minor, okay, you can take the class as a 4,000 and then enroll in 3280, 70 in the fall, and then Glenn, I'll talk to you, okay? Clear?
And anybody, sorry.
Yeah, Felicia, go ahead, sorry.
Thank you, Borja. And anyone, if you want a class in English, if you want another class in English, There's room in my MENA class. It's taught on site. It will give you credit for global perspectives and for creative arts, so you could get some of those credits out of the way too. And it's not because I'm trying to take students away from Borja. Everybody knows what a great teacher he is. It's just if you're interested in working on site, doing coursework about what you're seeing and what you're eating and what you're hearing, you can have that option in English in my MENA course. Thanks.
Okay, clear. Okay, so thank you. That was the only thing, and I will see you all next Friday, right? Well, Sophia, I will see you tomorrow. You're stuck with me.
All right, everybody. But yes, next Friday, at 5:30 to 7, more or less, it can be drop-in. You don't have to stay the whole time if you don't want to. But we'll kind of have an informal get-together to get to know each other in person before we're going abroad. So if you have time to come, please do. It should be fun. And like I said, low stress, low stakes. Just come hang out, take a break from studying and finals and all that.
And can I just say one more thing? Emma, you have done such a fantastic job. This is like the hardest job to tell people we have to do this, right? Before we go overseas together, we have to tell you about things like common sense and, you know, making good judgments and taking care of yourselves. But, you know, we know it's going to go really, really well. So we want you to just absorb this information, you know, hang on to it. And many, many thanks to Emma for this incredible presentation. Really, really helpful, really wonderful.
And many thanks to you both for designing such a fantastic program. I'm so excited. All right.
Okay.
Any last words?
Glenn, you stay, okay, for 5 minutes, okay?
Well, adios and
I had a quick question just for you, Emma.
Oh, yeah.